Good evening and welcome to our Sunday Night Live with Nurse Eunice. We're going to practice 50 multiple choice questions to help you prepare for the CNA examination. And I see that we have a lot of you already waiting, so thank you for your patience. We'll get started shortly. All right, so let us begin. Question number one. A resident with pneumonia might show which of the following symptoms? Is it A, increased energy, B, coughing with blood tinged sputum, C, swollen legs, or D, coughing with greenish sputum? And I hope you all have had a fantastic weekend and that you're looking forward to the work week. Our Christmas vacation is now officially over. All right, everybody, revealing the answer in three, two, and yes, you have it right. So, Taisha and Danita, you are correct. It is D. Pneumonia often presents with symptoms such as coughing with colored sputum, usually green, fever, and difficulty breathing. Question two. A walker may be used if the client can A, support some weight, B, use her hands well, C, balance without help, or D, walk independently. All right, so when might a walker be ordered? Revealing the answer in three, two, and yes, you all have it. It is A. So a walker is used by individuals who need some assistance with balance and support. If the patient can support some weight, they are likely able to use a walker to provide stability while walking. So great job, team. Question three. All right, so that one was about a walker, and this one involves a cane. So a cane should be used on, is it A, the affected weak side of the body, B, the side with the strongest arm, C, the unaffected strong side of the body, or D, the weak side one day and the strong side the next day? So D would definitely confuse some patients. So if you're helping someone walk with a cane, what do you recommend? Revealing the answer in three, two, I see A's, I see B's. And so let's say that someone had a stroke and that hand or that arm is shriveled. They can't hold a cane with the weak side of their body. So we're always going to allow them to use the cane on the strong side of the body so that they would have extra support on that side. All right, let's go to question number four. A patient is holding their abdomen and complaining of severe pain after eating. What condition might this indicate? You're crazy, Nurse Eunice. Your favorite buddy put urinary tract infection twice. So is it UTI, migraine, or gastric ulcer? And everyone has a great job. Gastric ulcers can cause abdominal pain that worsens after eating. So the answer is D. So this is a person, especially after they get through eating, if they have a diagnosis of gastric ulcers, you want to allow them to sit up some after they eat to give their food time to digest. Question five. When applying a cold treatment to a patient, it is important to observe the patient closely for signs of A, redness, B, dizziness, C, fainting, or D, cyanosis. All right, revealing the answer in three, two, and let's see what you have. If you chose, I see a lot of people choosing A for this one, but the correct response would be D. So usually cold compresses would stop blood flow. So it's going to be rare that the patient would turn red. More than likely, because of the decreased blood flow in the area, the correct response would be D. They would have signs of poor perfusion. So when cold treatments are applied, it is crucial to monitor the patient for changes in skin condition, such as cyanosis or bluish, which would indicate poor circulation of the tissue due to prolonged exposure to cold. Normally, your compressors should not be on for longer than 5 to 10 minutes, but your doctor or your plan of care should specify the length of time. Question 6. The purpose of correctly positioning the patient is to A, prevent skin breakdown, B, maintain function of the joints and muscles, C, increase comfort, or D, all of the above. I am so proud of you. Yes, it is D, all of the above. Proper positioning helps prevent skin breakdown, maintains joint and muscle function, and increases comfort for the client. It is essential for promoting the patient's overall health and well-being. Question number 7. A patient with long COVID is having trouble breathing. What position should the CNA assist them into? Is it supine, prone, Fowler's, or side lying? Long COVID means that they have those respiratory symptoms for weeks. And I see so many correct answers. You all, if you chose C, you got it. Remember, if someone's having a respiratory issue, they're having trouble breathing, we're going to sit them up. So Fowler's position, sitting upright, helps to ease breathing in patients with respiratory conditions. Let's go to question number 18. The preferred way to remove a bedpan from a client who is unable to lift her buttocks is to A, use a mechanical lifting device, B, have another nursing assistant lift the client, C, slowly slide the pan from under the client, or D, turn the client to the side while holding the pan. All right, give you a few moments to answer this one. I'll give you 10 full seconds. And I'm so proud of you for being online and studying with me on a Sunday night. You could be watching football, but nope, you're here studying and preparing for your exam. So revealing the answer in 3, 2, and yes, Mila, yes, Danita. Looks like we have Mirtha, Agnes, Sabani, Mary. We all have great answers. The correct response is D. So you're just not going to try to slide it from under them. You're going to have to turn them off of the bedpan. So D is the correct response. When a client is unable to lift their buttocks, turn the client to the side while carefully removing the bedpan ensures comfort and prevents injury. This method is safer than sliding the bedpan from underneath or using another person to lift the patient. And so if you all need to see the clinical skills videos, don't forget we have an entire playlist on our YouTube channel, and that would be youtube.com/Florida Training. Just look for the Prometric clinical skills videos. And those videos are not just specific to Prometric. If you are a caregiver and you need to know how to perform skills, that is a great playlist for you to review. Question number 9. After shaving a patient with a safety razor, the nurse aide should A, cover it before discarding it in the trash, B, wrap it in a paper towel and drop it into the trash can, C, dispose of it in a sharps container, or D, place it in the patient's drawer for reuse. And I know some of you all said you had tests coming up this week. So, of course, we're praying for you and we know you're going to be successful. I get so many of you all who contact me to let me know that you passed your test. So, I am so proud of you. And I'm happy to be one of your nurse tutors who help you during this journey. So, everybody, it is C. No, we're not going to put it in a trash can. This is going to go in the sharps container. So we do not, just put it back in a drawer. If this person is in a assisted living facility, maybe that may be the case. But for your test, the safest answer is what you're going for. And the safest answer is you've used a blade, a safety razor to shave somebody. Throw it in the, dispose of it in a biohazardous or safety container, the sharps container when you're done with it, so that the patient doesn't go back and try to shave on his own, and so that no one else gets in contact with this dirty razor, okay? Because it already has been used on the patient. Question number 10. A patient with Alzheimer's disease becomes agitated in the evening. What is this called? Sundowning, late night confusion syndrome, morning fatigue, or evening fatigue? Evening anxiety. Everybody has it right. I'm so proud of you. We call it sundowning. The answer is A. So sundowning refers to increased confusion and agitation in the evening. Question number 11. A patient with jaundice will have which physical sign? Is it pale skin, darkening of the skin and eyes, yellowing of the skin and eyes, or bluish lips? When we say the patient appears jaundiced, what are we talking about? Revealing the answer in 3, 2, and I am doing my nursing dance. You all have it. I think that it says B here, but the answer is C. Jaundice is characterized by yellowing of the skin and eyes, often due to liver dysfunction. So again, the slide is incorrect. If you chose C, you have the right answer. Question 12. Upon entering a room, the nurse aide notices that a patient is not breathing. The nurse aide's first action is to A, start chest compressions, B, lay the patient down on his back, C, give 4 quick breaths, or D, call for help. I see C's, I see D's, but the D's have it. So revealing the answer in 3, 2, and yes, everybody, you got to call your team. So if a patient is not breathing, the first step is to call for help to get emergency medical assistance. Plus, you're not about to put your mouth on a patient's mouth. So you need that crash cart. You need the breathing equipment. You need the back mask device. So because a person's not breathing, this includes activating the EMS or emergency response system. If you're inside of a hospital, that's you pressing the code button. If you're outside of a hospital, that means you're calling 911. After calling for help, the aide can proceed with CPR if trained and instructed to do so. The priority is to get professional assistance quickly. So if this person is pulseless and they are not breathing, you can do hands-only CPR until the advanced rescuers come or until the crash cart get there. Remember, in the real world, we're not putting our mouths on our patient's mouth. We do not perform mouth to mouth. So you can do compression-only CPR until the other equipment and team members arrive to assist you. Question 13. A patient is on bed rest wearing anti-embolytic stockings. How often should the stockings be removed? A, never. B, Q2H. C, at least twice a day. Or D, Q6H. Ooh, those infamous medical abbreviations. What's the correct answer, team? All right, we'll reveal the response in 5, 4, 3, 2, and we are torn between B's and C's. B's and C's. And Taisha, when you don't know, go with what's safest for that patient. And so the safest response is going to be B, Q2H, every 2 hours. If it would have said every shift, I know that's about how often we would probably do it in the real world, but when you take your test, it's not real world, it's perfect world. You only have this one patient, so you can literally spend 10 minutes putting on these TED holes, and then you'll take them off every 2 hours to prevent those indentations, etc. So the rationale. The anti-embolytic stockings should be removed every 2 hours to assess the skin and promote circulation. Keeping the stockings on too long can lead to skin breakdown or discomfort, and it is necessary to check skin for redness or irritation periodically. Those are the TED hose, Mila. So those are the really tight hose that prevents the patient's blood pressure from dropping when they stand up. And so if you've never seen them, just go ahead and Google it real quickly. But it's called TED stockings or TED hose, TED. Question 14. Pressure ulcers, also called decubitus ulcers, can be prevented by A, changing the client's position every 2 hours, B, placing a gel or foam pad on top of the mattress, C, increasing the client's consumption of vitamin C, D, both A and B. And I see some of you all saying that you didn't understand the terminology. So we do have videos that discuss medical abbreviations. And so if you haven't watched those, we do recommend that you do so. You may not have a lot of abbreviations on your CNA examination. However, as soon as you pass that test and you get in the real world, we speak in abbreviations. The doctors write in shorthand abbreviations. So you're going to have to learn it eventually. All right, everybody, for question 14, the correct response is D, both A and B. So pressure ulcers can be prevented by repositioning the patient every 2 hours or Q2H to alleviate pressure on bony prominences. Bony prominences are anywhere where bone is touching bone or bone is touching bedding. That's where a person's more likely to have skin breakdown. So when someone is laying on their back, it's going to be their coccyx, their tailbone. If they're laying on their side, it's going to be the hip. So that would be a bony prominence. So we can alleviate pressure by turning them Q2H and by also using specialized padding such as a gel or foam pad to reduce the pressure on the mattress. Question number 15. The first step in getting the client up to walk is, let's see, A, sit the client on the side of the bed. B, put the client's slippers on. C, check the activity order. Or D, tell the client he will be getting up. And I'm going to take a bite of my dinner. My son just brought me a plate of food. You all are torn between A's and B's. I see a lot of A's. I see a lot of B's. Now I see a D and a C. We'll reveal the answer in 5, 4, 3, 2. Don't you all get anybody up without checking that order first. So if you chose C, you have it. You all are going in explaining stuff to a patient, sitting them up, putting on their slippers. Meanwhile, there wasn't an order for it. So before assisting a client to walk, it is essential to verify the activity order provided by the healthcare provider. This patient could have been on complete bed rest and you're getting them up and walking them. This ensures that the client is medically cleared to engage in ambulation and prevents potential harm if there are restrictions on movements. So don't forget to check those orders in the care plan. Question 16. We have some vital signs. So the blood pressure is 118/80. The respiratory rate is 10. The temperature is 98.8 degrees Fahrenheit. And the pulse is 80. Which of those vital signs should be reported? Is it respiration, temperature, pulse, or blood pressure? And I see some familiar names. I love you all. Thank you all for tuning in again. You are my peoples. All right, here we go, team. Revealing the answer in 3, 2, and it's the respirations. They should not be breathing 10 breaths per minute. So a respiration rate of 10 is abnormal and should be reported immediately. You can try to stimulate the patient, but still let the nurse know, because the nurse may be giving them the morphine that's causing their breathing to be suppressed. So normal respiration rates for adults range from 12 to 20 breaths per minute. A rate of 10 is below normal and could indicate respiratory distress or other serious conditions. And so if you've been here for this long, if you've learned anything, give me a thumbs up. If you haven't subscribed, go ahead and subscribe to our channel. And now we will continue. Remember, the algorithm will not promote our videos if we do not show engagement. So thank you all for engaging. Question number 17. What is the priority when caring for a resident who is actively vomiting? Patient's vomiting. What do you do? A, offer them food. B, turn them to their side. C, leave them alone to rest. Or D, provide a blanket. From those options, which is the best response? What would a competent CNA do? Yes, Yolanda, Chrissy, Agnes, Hamdi, Tamarser, I mispronounced your name, Mrs. Love, Child of God, Liz, Danita, Satu, you have it. It is B. Now, this is assuming the person just couldn't sit up. So, but if the person can't sit up, you're going to turn them to the side. Turning a vomiting patient to their side prevents aspiration of vomit into their lungs. Mila says that question is scary. Mila, it gets pretty scary, but just think it from the patient's point of view. They are the one who is vomiting. So we just have to take care of them and try to be as calm as possible, because they're going to feed off of your energy. So if you're scared or you're nervous, that's going to make their condition worse. Question 18. Diastolic blood pressure is determined by A, listening for the first clear sound, B, listening for the last clear sound, C, subtracting the lower number from the top, or D, adding the top and bottom numbers. Look, you all have enough math to do. So when you're trying to take a blood pressure, you're not doing calculations. So that's the only hint I'm going to give you. Revealing the answer in 5, 4, 3, 2, and almost everybody had it. The diastolic blood pressure is B. It is the last clear cortical sound, the last thump you're going to hear. So the diastolic blood pressure is recorded when the last clear sound is heard as the cuff pressure is released. This sound indicates the point at which the heart is at rest between beats. Alternately, the systolic pressure is determined by the first sound. So when you're taking a manual blood pressure, you're listening for the first sound and remembering the number, and also the last sound. And that's how we would get 118/80. And we do have videos that also show you how to read a blood pressure gauge and how to perform the manual blood pressure skills in our clinical skills playlist on YouTube. Question 19. A patient with CHF, congestive heart failure, may exhibit which of the following? A, weight loss, B, swelling in the abdominal cavity, C, increased urine output, or D, swelling in the legs and feet. And I hope you are as proud of yourself as I am of you, because I'm watching you and you're getting all of these questions correct. You're answering them correctly. That means that you are studying and that you're going to be a very strong and competent CNA who can take care of our patients the way they should be cared for. So question 19 is D. That's right. Congestive heart failure, CHF, often causes fluid retention, and the place you're going to see it first is going to be the extremities, leading to swelling in the legs and the feet. Question number 20, and we're going all the way to 50. So question number 20, a diabetic patient with a fruity odor on their breath might have hypoglycemia, hyperglycemia, kidney failure, or dehydration. What does that fruity odor actually represent? Now, I'll give you 5 seconds for this one. I have D's, I have A's. I'll give a few more of you time to respond. All right, I'm revealing the answer in 3, 2, and looks like a lot of you didn't know this one. Nurse Eunice taught you something new. It means that their sugar levels are high. They have hyperglycemia. So that fruity odor is a symptom of diabetic ketoacidosis, a serious complication of hyperglycemia. Okay. Let's go to question 21. Which of the following best destroys all bacteria on medical instruments? You're like, I'm a CNA. Why do I need to know about this? Because when your patient goes to surgery, if we don't take care of that equipment correctly, your patient comes back to you and now they're septic and they're really sick and they can die. So why do we care about the bacteria on medical instruments? Let's see. Should they be soaked in alcohol, washed with bleach, sterilized, or scrubbed in hot water? Remember, in the medical field, you are not an island unto yourself. You have to work with all these disciplines. You have to work with all these different departments. So it's important for you to kind of know what happens in a different department. So revealing the answer in 3, 2, and yes, they have to sterilize that equipment. So sterilization is the process that destroys all forms of microbial life, including bacteria, viruses, and spores. It is the most effective method for ensuring an item is free from harmful microorganisms. Question number 22. A resident complaining of sudden sharp chest pain while breathing may have pneumonia, apnea, bronchitis, or a pulmonary embolism. Nurse Eunice, why are you talking about all these different disorders? Because you're going to be taking care of people who have acute changes. And I need for you to know when to notify your nurse stat. So if someone suddenly starts having sharp chest pain while they're breathing, what do you think is happening to them? Yes, 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 it is D. I see you, Mary Phlebotomy and Danita and Liz. So sudden chest pain while breathing. They take a deep breath in. Oh, that hurts. That can mean that they could have a blood clot in their lung, aka pulmonary embolism. You get that nurse in the room right away. You're not trying to scare the person. You just need to be aware of when things change, especially if something causes pain that's not normal. You could be thinking about PE, but get your nurse in there so she can evaluate. Question 23. Safe use of oxygen therapy includes A, always setting the flow meter at 2 to 3 liters per minute. B, using wool blankets only to keep the patient warm. C, cleansing the nasal prongs each shift with alcohol. Or D, using caution with oxygen tubing so the client does not trip and or get it entangled in the furniture. Oxygen safety, so we know not to smoke around oxygen. But what else must we be worried about? And this is super easy. So I'm revealing the answer in 3, 2, and that is right. Don't let your patients trip over the oxygen tubing. That is a fall hazard. So the correct answer is D. Question 24. Which of the following is a symptom of a blood clot in the leg? Is it A, red, swollen, and warm area? B, sudden itching? C, cold and pale skin? Or D, blister formation? Yes, Hamdi. Yes, Taisha. You all were fast with this one. So, revealing the answer in 3, 2, and it is A. So, a blood clot in the leg or a DVT, a deep vein thrombosis, often causes redness, swelling, and warmth in the affected area. Question 25. A procedure manual is a book listing the procedure a nurse aide has been assigned to do. B, set of directions needed to complete a nurse aide's job description. C, book of directions for administering medications. D, written set of instructions on how to perform procedures. What is a procedure manual? All right, revealing the answer in 3, 2, and if you chose D, you're absolutely correct. A procedure manual contains specific written instructions on how to carry out clinical tasks or procedures. So you don't get a pass, you all. You can't be like, oh, I forgot, especially your nurses. They can't be like, oh, I forgot how to do it, or this is how I did at my other hospital, because every hospital, every nursing home should have a written set of instructions. We don't care what you did at hospital A. This is the way hospital B does it. Here are the instructions. Let me see you do it the way that we require you to do it. I want to check you off. And then if you revert back and you do it the way the hospital A showed you how to do it 10 years ago, you're going to be out of compliance and you could be liable if something happens with that patient. So when in doubt, we refer to the current procedural manual to make sure we're doing things the proper way. Question 26. If a client cannot speak English, the nurse aide should A, have the family interpret, B, ask the charge nurse to arrange for an interpreter, C, call the doctor to talk to the client, D, tell the client that she cannot answer the question. What a way to end communication. So D is definitely not the answer. All right, revealing the answer in 5, 4, 3, 2. I think everybody has it. It is B. Now, hopefully your charge nurse is smart enough, or maybe your charge nurse didn't know the patient didn't speak English. Maybe, but so please communicate, because hopefully you wouldn't be the one who has to actually ask for the interpreter. So if a client cannot speak English, it is important to provide effective communication. A lot of your facilities have communication boards. They are laminated pieces of paper that will have a picture of a cup, the pain scale with the smiley and the crying faces, pictures of pills, etc., and also numbers. So if they can't say, if we can't understand them that way, they can point to it on the board. But if that fails, most hospitals have a contract with an interpretation company that, of course, will protect patient confidentiality and translate every word that we say to the patient. We don't usually allow the family members to translate because they won't translate every word, and we can't be sure if they're actually saying what we are telling the patient. So that's particularly important when we're preparing them for surgeries. Question 27. What is code red commonly used for? Ooh, is it A, fire or smoke, B, active shooter, C, hazardous spill, or D, severe weather? Code red. Code red. What does code red refer to? Revealing the correct response in 3, 2, and you all understand the assignment. Code red means we need the fire team. You go get the fire blanket. The other person goes and closes the fire doors. Someone else moves the patients out of the way. And so honestly, it should have been move the patients out of the way first. So forgive me. But we have a whole fire team, and we designate our fire teams at the beginning of each shift. So a code red typically indicates a fire or smoke emergency. Question 28. What does code blue typically indicate? Is it A, fire in the building, B, medical emergency requiring resuscitation, C, missing resident, or D, active shooter? And when you're in your facilities, they usually give you a device, I want to say a badge, I can't think of what you call it, but it's going to be something you can place on the back of your badge, and it will have all of the codes and what those different colors mean so that you'll be able to respond more quickly. So question number 28, code blue means cardiac arrest. So code blue signals a medical emergency such as cardiac or respiratory arrest. So that's when the rapid response, that code team would come. Question 29. When performing perineal care on a male client, always A, clean the scrotum first, B, clean from front to back, C, hold the penis at a 90-degree angle, or D, retract the foreskin if uncircumcised. Let's see what you're thinking. Let's see. So I have a lot of B's, I have a lot of D's, and I saw one or two C's. So revealing the correct response in 3, 2, and yes, we have to do D. If they're uncircumcised, we have to pull back that excess skin, that foreskin, because underneath it is a lot of gook sometimes. It can be a lot of germs, yeast, etc. So when performing perineal care on a male client who is uncircumcised, it's important to retract the foreskin to clean underneath it. And then once you wash it, rinse it, and dry it, you're going to return that retracted skin back to its normal position. This helps to prevent infections. Also, always clean from front to back. So we start at the tip of the penis, that's the meatus, and then we work our way all the way down the shaft towards the base where the hair is, and then we clean the testicles. And don't forget, the older you get, your testicles are not nice and firm. The older you get, they hang down low. So make sure you pick them up, CNAs, and clean beneath them, because sometimes you forget and you miss a spot, and a person can have old stool beneath their testicles. Okay, so make sure you clean them well. I know I gave you the visual. All right, so question 30, team. A resident on blood thinners accidentally cuts their hand. What is the first action? And if you watched my video from yesterday, you know what the first action is. Is it A, wash the wound with soap, B, apply pressure to stop the bleeding, C, notify the nurse immediately, or D, cover the wound with a bandage? You are such great healthcare providers. I am so proud of you. All right. So if someone's cut, you apply pressure and then you scream for the nurse. It is B, everybody. Applying pressure helps control the bleeding, which is critical in patients on blood thinners. So you're not going to try to find the call bell, find the button, the call light in order to call your nurse when your patient is actively bleeding. You apply direct pressure, and if you can't get to the call light, you will scream help to alert your other team members, or you will ask the patient to apply pressure. You will never leave the room, but you can at least go and open up that door so that maybe your voice could be heard further down the hall. Question 31. Which is the most critical CNA action for a patient with aspiration precautions? Is it A, feed the patient quickly to ensure they eat enough? B, assist the patient into a comfortable position? C, monitor for coughing or choking during meals? Or D, keep the patient in a wheelchair during meals? What is critical? Which one is the most important action? I tricked you all. Some of you chose B. The most comfortable position for a patient could be laying down. So when you're thinking about aspiration precautions, we're not thinking about comfort. We're going to be monitoring them. It is C, monitor for signs of aspiration, example, coughing. And as long as you're monitoring them while they're eating, it helps to ensure prompt intervention if needed. Question 32. A decubitus ulcer can be caused by all of the following except A, poor nutrition, B, pressure on the skin, C, poor circulation, or D, cotton clothing? This one is an except, so when you take your test, make sure you're looking out for those exceptions. So which one is not correct? Revealing the answer in 3, 2, and it's D. Cotton clothing has nothing to do with causing a pressure sore. If it said wrinkled clothing, that would be different. But decubitus ulcers are primarily caused by prolonged pressure on the skin, poor circulation, and inadequate nutrition, also keeping the patient wet, all of which inhibit the skin's ability to heal. Question 33. For a patient with a swallowing disorder, which food is safest to serve? So this patient has a swallowing condition. Are you going to serve them A, room temperature water, B, regular pasta, C, soda, or D, pureed vegetables? I tricked you, Mary. Let's see. All right, you all have it. Whenever someone is on swallow or aspiration precautions, we don't give them anything thin like water. So it doesn't matter if the water's cold or room temperature. We probably need to add some thickener to it. So the correct response is going to be D, everybody. They can have pureed vegetables. So pureed foods reduces the risk of aspiration compared to thin liquids or solids. Question 34. How should a CNA position a resident after a meal to prevent aspiration? Is it A, supine for comfort, B, upright for 30 minutes, C, side lying with a pillow? Oh, that's my favorite sleeping position right there. Or D, reclined at 30 degrees? Revealing the answer in 5, 4, 3, 2, and everybody has it right. Yay! So it's going to be upright for 30 minutes. It's going to be B. And you don't have to have them sitting all the way up at 90 degrees, but you can take them back somewhat to maybe 60 degrees. And then after they've set up some and their food has had time to digest, if they desire to lay back further, you can do so after the 30 minutes has passed. All right, so keeping them upright prevents regurgitation and aspiration. Question 35. A patient on droplet precaution should A, have the door to their room closed at all times, B, wear a mask if they leave the room, C, be placed in a negative pressure room, D, have no visitors. Droplet precautions. All right, this one's a little more trickier, so I'll give you an additional 5 seconds to answer this. All right, let's see, because this one's hard for me. Revealing the answer in 3, 2, and that's right. They are contagious, you all. They're on precaution. So if they leave the room, they need to wear a mask. So the answer is B. Give yourself applause. So patients on droplet precautions, aka patients who have the flu, should wear a mask when leaving their room to prevent the spread of droplets. We can't keep them in the room all the time. They need chest x-rays. They may need to go take additional diagnostic exams or tests. So when they leave the room, they have to mask up. Question 36. A patient in contact precautions is likely to have which condition? Is it influenza, measles, tuberculosis, or C, difficile infection? Contact precautions. What do you think they have? So we talked about droplet precautions. Now we're on contact precautions. So if it's contact, it must not be airborne. So process of elimination, which of these is not spread in the air or via droplets? All right, revealing the answer in 3, 2, and Actually, it is D. It is C. diff. So C. diff requires contact precautions to prevent the spread of infections. I know you all want to choose measles, but measles can also be spread in the air. So, question number 37. A resident on fall precautions should have A. Shoes with rubber soles, B. Socks without grip, C. Open toe sandals, D. Bare feet for better balance. All right, resident fall precautions. What do you think the best or the safest would be before we get them up? And if you chose A, you are right. In your facilities, they also have the socks with the grippies. So in your facilities, those socks are acceptable. But trouser socks or just everyday socks without the grippies are never acceptable because your patient may stand up and start slipping. So shoes with rubber soles help prevent slipping and provide good traction. Question 38. Before transferring a client from the bed to the wheelchair, the nurse aide should sit her on the edge of the bed for a few minutes to A. Rearrange her gown and clothing, B. Prevent orthostatic hypotension, C. Position and secure the wheelchair, or D. Rest and remove the transfer belt. All right, so why are we going to have the resident sit at the edge of the bed for a few minutes? And I see so many of you all choosing C. Remember, we're thinking about patient safety, so we're not having her sit to the edge of the bed so we can prepare the wheelchair. We're having her sit to the edge of the bed so she doesn't stand up and fall. So the answer is B. We have to prevent the orthostatic hypotension. The rationale: sitting the client on the edge of the bed before transferring to a wheelchair helps prevent the orthostatic hypotension, a condition where the blood pressure drops when standing, leading to dizziness or fainting. Allowing the client to sit and adjust before standing gives their body time to stabilize. So, yes, you're sitting them up for that reason, but then while they're sitting up, you now have time to prepare your equipment, put the shoes on their feet, etc., before you stand them. You always want to ask, are they dizzy before you stand them? Because if they say that they're dizzy, you don't stand them. You put them back in the bed and you notify your nurse. Question 39. What is the primary purpose of range of motion ROM exercises? Is it A, prevent muscle atrophy and joint stiffness? B, build muscle mass? C, reduce the need for ambulation? D, improve circulation only? And this one's kind of tricky. Or at least I thought it was tricky. But looks like Adelina, Anna Kay, Sabani, Berth, Agnes, Mirtha, Delma, Sundahari. It's a lot of you all. Everybody chose A. So range of motion exercises help to prevent muscle atrophy and maintain joint flexibility. They don't help build muscle mass, but they do decrease muscle loss. Remember, they're not lifting these heavy weights. So we're not going to be building muscle mass. We're just trying to keep them moving because it improves circulation, it decreases joint stiffness, and it also aids in prevention of muscle wasting or atrophy. Question 40. We got 10 more to go, team. I hope you're proud of yourself. Super easy. What is the first step in hand washing? A, apply soap. B, wet hands and wrist. C, rub palms together. Or D, dry hands with a paper towel. Remember, when you take your CNA test, when you're doing your skills, if you don't wash your hands before and after care, you will fail. So you have this nurse evaluator watching you. What do you do first when you're at that sink? Yes, all my people who put B, they understand that proper hand washing begins with wetting the hands. Think of it this way. If you turn the water on, or if you just get your soap first and then you turn your water on and wet your hands, your soap goes down the drain. It's not on your hands where you need it at. So you're going to turn your water on, you're going to wet your hands and your wrist because you have to clean both, and you're going to apply a sufficient amount of soap, and then you start lathering. So I hope that helps you understand the process. Question 41. Dying patients and their families. A, always pass through 5 stages of dying in order. B, always accepts death before it occurs. C, may go back and forth among the 5 stages. D, must go through all stages of dying before they die. You all are so smart. You are so smart. That's right, you all. They can vacillate. They can go back and forth. One day they're upset and angry. The next day they're accepting it. The next day they want a second opinion or a new doctor. So the 5 stages of dying: denial, anger, bargaining, depression, and acceptance are not always experienced in a linear fashion. Dying patients and their families may move back and forth between the stages as they process the reality of death. Acceptance may occur early or late in the process, and not all patients or family members experience all stages. Usually, if a patient or family member has accepted the fact that someone is dying, they will go ahead and consult hospice. All right, question 42. A resident on isolation precautions has a meal tray delivered. What should the CNA do? A, ask another CNA to deliver the tray. B, serve the resident last. C, leave the tray outside the resident's room. D, use appropriate personal protective equipment, PPE, to deliver the tray. That's right, Adelina, Berth, Mirtha, Hamdi. We're not going to make that patient wait to last because they're on isolation. I need you to gown up. You're going in that room and delivering that food while it's hot. So the answer is going to be D, everybody. PPE must be used to enter isolation room safely and deliver care or meals. Question 43. What is the best response if a resident refuses a bath? A, inform them that they are required to bathe daily. B, report their refusal to the nurse immediately. C, offer the resident an alternative time for a bath. D, bathe them against their will. Oh, Lord, I'm going to see you on the news. It was so nice knowing you. So D is never the answer. All right, so revealing the correct response in 3, 2, and for all of you who put C, you have it. You're going to respect the residents' preferences and offer alternatives. Maybe they don't want to watch it right now because the Price is Right or Bonanza's on. They're watching their favorite Western. You will ask them when you can come back and give the bath. Don't forget to document, because we already mentioned sundowning. So if you offer it twice on your shift and they refuse, you're going to document it. You're going to let the nurse know that the patient refused twice, because when their daughter comes in at 9 p.m. and mom doesn't smell as fresh, mom's going to say, she never offered me a bath. Your documentation is going to save you. Question 44. What is the CNA's role during a code blue emergency? So we just read that code blue stands for an emergency, a medical emergency that requires resuscitation. So what are you going to do? A, retrieve the crash cart and follow the nurse's instructions. B, call the resident's family. C, charge the AED. Or D, administer oxygen. That's right, Tabitha and Sophia and Imani and Sophia and Isatu. It is going to be A. All right. So depending on where the crash cart's at, in some of your hospitals, they're locked in the med room. So of course you can't get it out the med room. But if you're in a nursing home and it's just in a centralized area, you're young. You're going to run faster than I am. I need to be there doing the chest compression, starting the IV. I'm going to get you to go get that crash cart. So the CNA's role during Code Blue is to provide assistance as directed by the nurse or medical team. And sometimes we just have you run to go get supplies because we're trying to prevent the arrest. So, hey, go get the bag of saline. Hey, go get this. All right. And so question number 45. The doctor writes an order for do not resuscitate DNR. What does this mean? A, put the client on a machine if she stops breathing. B, the client needs to be kept alive. C, CPR will not be performed. D, start CPR immediately if the client stops breathing. What does DNR stand for? All right, and Anna Kay and Hamdi and Nakalunga and Yolanda and Berth and Agnes and Ketty Bien and Delma and Liz, you all have it. You know that DNR stands for do not resuscitate. We are not going to be performing CPR. Okay, so some people may have a limited CPR. Well, they may not want blood products, but your nurse and you at the beginning of every shift, you should look at your code status for all of your patients and note whether someone is a full DNR, a full code, or a limited DNR. So a DNR order means that in the event of a client's heart stopping or they stop breathing, cardiopulmonary resuscitation, CPR, will not be performed. The DNR order is intended to prevent unnecessary or unwanted interventions at the end of life, allowing the client to die naturally. It does not imply that all care should cease, just that resuscitation efforts should not be attempted. So we don't leave them alone to die. We still provide great care to them and for them. But if their heart should stop or if they should stop breathing, we're going to allow natural death. So another term for DNR is AND, and AND stands for allow natural death. That sounds more empathetic. Question 46. Which of the following is not appropriate when providing oral care to conscious resident? Is it A, turning the resident's head to the side, B, using a soft bristled toothbrush, C, providing mouth care every 2 hours, or D, using excessive amounts of liquid? Adelina, thank you so much for such a kind comment. I appreciate that. All right, so which of the following is not appropriate? That is right. Because if this patient is unconscious, that more than likely means that they either have a weak gag reflex or no gag reflex at all. So you would not do D. You would not put an excessive amount of liquid in their mouth because that's going to increase the risk of aspiration. When you're cleaning their mouth, you're going to use the least amount of liquid as possible. You should just put your sponge. You're going to dip it into the mouthwash, and the mouthwashes in your facilities are small bottles. They're not huge bottles. You're going to dip a clean sponge in the mouthwash container, or you can pour a little bit of mouthwash onto the actual sponge itself, and you go around their teeth, their gums, and their tongue, and you, with the least amount of mouthwash, the least amount of fluid, you provide the oral care. And if you have a suction wand or suction equipment, you can suck out any secretions that may have built up when you were in there cleaning their airway, their mouth, excuse me. Question 47. A client with dementia makes sexual advances toward another client who has dementia. Oh boy. The nurse aide should A, allow it. OBRA 87 states that clients must be allowed to fulfill sexual needs. B, asks them to keep their sexual activity in a private place. C, ignore it so as not to embarrass them. D, tell the charge nurse since a client with dementia is unable to give consent. And everybody got it right. We have to protect our patients. So the correct response is going to be D. 2 patients with dementia, they are not consenting adults. They don't have the mental capacity. So clients with dementia may not have the ability to understand social boundaries or give consent to sexual activity. The nurse aide should inform the charge nurse about the situation to ensure proper handling and to protect the dignity and safety of all individuals involved. Ignoring the behavior, allowing it, or directing them to be private without addressing the issue is inappropriate. Question 48. When assisting a resident with a partial bed bath, which area should be washed first? Why does it even matter? I mean, who cares? Let's just wash the resident. Are we going to wash the face first, the perineal area first, the chest, or the arms first? Where is that washcloth going first, you all? All right. Revealing the answer in 5, 4, 3, 2, and thankfully, no one answered it incorrectly. We always wash from the cleanest to the dirtiest. So that means when you're given a bed bath, you're starting with the face. The answer is A, and then you work your way down to those more dirty areas, such as the chest, the armpits, and then you work your way down to the perineal area. You can have as many washcloths as you need, but just start with the face first. Question 49. A resident is confined to her bed. What might keep her from getting pressure sores? A, a plastic draw sheet, B, a footboard, C, body lotion, or D, an air mattress. So we have a bed-bound resident. How are we going to prevent her from getting pressure sores? Revealing the answer in 3, 2, and that's right. It is D. We need an air mattress because it helps to prevent pressure sores by redistributing the pressure, which reduces the chance of skin breakdown. Question 50. During the skills test, you are asked to assist the resident with ambulation using the gait belt. What should you do if the resident starts to feel dizzy? A, continue ambulating slowly. B, encourage the resident to keep walking until the dizziness passes. C, remove the gait belt and call for help. Or D, sit the resident in the nearest chair or safely lower them to the floor. All right, revealing the correct response in 5, 4, 3, 2, and the safest thing to do is to get them to the floor. It is D. If there's no chair nearby, like you cannot stand somebody up who is dizzy. They're going to fall. Either they're going to fall on you or they're going to fall on that floor. So let's go ahead and get them down smoothly and safely. That would not be a fall. That would be an assist to the floor if you assisted them to the floor. While, of course, you are screaming for help. So safely seating or lowering residents prevents falls and further injury, thereby ensuring their safety. And when you sit them down, you still need to be holding them because we don't want them to still be dizzy while they're seated on the floor and they fall and they hit their head on the ground. So it's not that, oh, they're on the floor, I can leave them. If they're on the floor and they still require your attention and your care. So my team, guess what? We just worked the whole 8-hour shift. Yes, we did. And so I appreciate you all so much. Thank you all for watching. It has been fun. And in 2025, I'm going to make it my business to get on this channel 5 nights this week, and then the other week, so there'll be 3 nights. So I'm going to try to come on about the same time each night this week so we can do some practice tests, whether you're preparing for your CNA test or your NCLEX. I'm going to be here. I love being your nursing instructor. And so everybody, this is Nurse Eunice. Please, if you haven't done so, like the video. If you haven't subscribed, please subscribe. If you have questions, I'll stay around for about 2 minutes and answer those questions. Otherwise, I love you. I pray for you. I wish you all much success, and I'll see you all in the next video. And you all are so welcome.